Now, the need for vaccine manufacturing capability is of critical importance, more now than ever, as a result of the COVID-19 pandemic. But South Africa has not been in a position to develop and produce its own coronavirus injections yet. The history of vaccine manufacturing is checkered in the country. However, there is currently a shortage of injection supply chains. To discuss this, we are joined by Professor David Walwyn from the University of Pretoria. Now, he published a paper in 2018 about South Africa's vaccine manufacturing capacity. Professor Walwyn, good afternoon. Tell us a little bit about your predictions from almost 3 years ago.
Good afternoon, Hugo, and thank you so much for having me on the program. 3 years ago, I wrote up the story of the BioVac Institute, which was South Africa's public-private partnership set up in 2003 in order to establish vaccine manufacture. And I mean, it's a long time ago. That's more than 18 years ago, or 18 years ago exactly. And it was a partnership that was intended to rescue the remaining capability in South Africa for vaccine manufacture. And the idea was that within 5 years, we would be able to establish a world-class manufacturing facility in Cape Town on the premises of the State Vaccine Institute. But that never really transpired. There were all sorts of issues that arose and problems in the establishment of that capability. And so today we still sit in a situation where we're not able to make the active ingredients, the antigens themselves for the vaccines, and so we can't mount an effective vaccination campaign in terms of COVID-19.
Well, Professor Walwyn, I would assume that with at least 3 million children needing to be vaccinated every year, that it would make a good business case.
I don't think it's as many as that. I think there are about 1 million births, maybe 1.5 million births each year. But yeah, those children have to be vaccinated, those babies, and they probably require 3 or 4 doses each. So yes, we do have a lot of doses that we need annually. But in fact, to make a strong business case or to have a proper business plan, you need about 100 million doses a year in a vaccine manufacturing facility. And we're not at anything like that level. We're at about 10% of that level in the country.
So what was the basis of your suggestion that we should be creating or building a vaccine producing capabilities within South Africa? Presumably, it's to sell to other countries in the region?
Exactly. I mean, look, I think there are a number of ways of approaching this. One way could be for the government to accept that this is an issue of health security or health systems resilience, and therefore they have to put money into it each year in order to retain that capability. So, it would have to be subsidized. But for it to be profitable and viable, it would need to export into the region. And I mean, that wouldn't be difficult. We have companies that do that all the time. So the Aspen Pharmacare, for instance, they do a lot of Africa exports, and they are able to build critical mass in certain products as a consequence of being able to access the local markets. So I think one of the suggestions from the study was this issue of pooled procurement. So in SADC, if we pooled all the procurement for the vaccines, we would be able to meet that 100 million doses a year threshold.
Well, Johnson & Johnson locally is involved in some form of manufacturing arrangements. Does that then confirm what you suggested earlier?
It does and it doesn't. I mean, the Johnson & Johnson deal with Aspen is actually around formulation. So just very quickly on this, vaccines have got an active ingredient. So this is an ingredient which is responsible for generating the antigen, for the immune response. That's the antigen itself. And we're not able to make that in the country. So what Aspen are doing, they are importing from Johnson & Johnson. They're importing the active ingredient, and then they're formulating that and putting it into vials and then distributing the vials. So, I mean, partly that takes us one step of the way, but actually we need to be an antigen manufacturer if we want to be able to have an effective response against something like the pandemic.
Now, put into context for us, Professor, we're looking to achieve a threshold of some 40 million vaccines. Now, just how much in vaccination do we need beyond achieving that threshold over the next few years?
It depends on how many variants SARS-CoV-2 throws at us. I mean, theoretically, let's say that we go with the Johnson & Johnson vaccine. Johnson & Johnson is actually a single dose, but let's say we go with the Pfizer vaccine, which is a double dose, then, and we have a population of 55 million and we want an 80% coverage, then as you said, that's about 44, 45 million people. Times 2 doses, that's 90 million doses that we need. And so that's already, a critical mass facility, 90 million doses or very close to it. And we would be able to have a strong business case just meeting our own internal demand. But I mean, if there are a number of variants and people have to be repeat vaccinated, then this is something that could go on for several years, and we would quite quickly be able to fill a large-scale facility. So I just think, I mean, the future is very uncertain in terms of how many doses we will need. But at this point, we need 90 million doses if we're going to take a vaccine, which is a double-dose vaccine.
It's unlikely that we are going to have these numbers that COVID-19 has presented to us in terms of requirements of doses. Do you think that this would have moved government into possibly considering setting up the facilities that you speak of?
Having worked in this field, and my field of research is localization. So how do we localize, leading edge technologies in the country in order to meet our own internal markets and also the kind of export markets in the region? That's what I work on, and so I would very much hope that government is going to come to that perspective. But historically we've had a policy preference for health policy over industrial policy, meaning that we prefer to access pharmaceuticals and medical products internationally at lower prices than maybe having to pay a premium for a local product which is locally manufactured. And so industrial policy has taken a back seat, really, in terms of our policy environment. Now, I mean, you would say this is a window of opportunity for industrial policy. This is the moment when people who are pro-industrial development in South Africa can come forward and say, this is what happens if you don't have a capability for local manufacture. You're not able to mount a vaccination campaign, and you have limited resilience in your health system. So in a way, I mean, that 2018 article made this point very strongly, is that yes, you can gamble on low-cost products which you can import internationally, but at some point the chickens are going to come home to roost when now you need to stand in a long queue of countries wanting to access a critical medicine which you are not able to access simply because you can't manufacture it yourself.
So maybe not South Africa, but is this an opportunity for Africa as a whole to come together?
That would be fantastic, and the Pan-African Organization, and I mean African Union, sorry, the Pan-African Organization, but the African Union has had a pharmaceutical manufacturing plan. The problem is that this is 57 countries, and they all have their own objectives, and getting alignment from 57 countries, and maybe it's more since I last counted, but it's not an easy task. The goal would be for Africa to be able to come together with a united approach to pharmaceutical manufacturing. And the study that we've just done really with the Open Society Foundation, I apologize, that study was about Africa-wide pharmaceutical manufacturing. And it also made that point very strongly, is that we needed political commitment, we need political engagement with the issue of health security. We need to lay aside national differences in order to bring this pharmaceutical manufacturing capacity onto front stage.
Final question, Professor. We seem to have been slow off the mark, so to speak, and as far as our vaccination of the general populace of South Africa is concerned. Your thoughts, what would you do if you were making those decisions?
I absolutely agree with you about being slow off the mark. I mean, there's nothing more wrong with me. I went for a routine blood test, and I asked the nurse who took the blood sample, have you been vaccinated? And she said, no, she hasn't yet been vaccinated. There she is, a health worker in the front line, not yet vaccinated. And I just think that's a terrible shame that someone who's at that level of risk should not have yet received a vaccine, when in some countries there's up to 70% coverage. So yes, we've been slow, And I'm not blaming anyone for that or saying that I could have done things differently. But, I mean, clearly we need to expedite this vaccine procurement as fast as we possibly can at this point and make sure that as soon as it arrives on our shores, we have the plans in place to be able to roll out a mass vaccination campaign. So, I was listening to that discussion you were having about the accident on the N1 and thinking, well, I'm very pleased that I'm not on the N1. But I'm not so pleased about the fact that I haven't yet been vaccinated, and I'm sure neither are you, and certainly the health worker I spoke to this morning is not pleased she hasn't been vaccinated. So we would all like to get vaccinated, and that means that we really do need an emergency response and an emergency plan in place. And as soon as those promised supplies of vaccine arrive, that we can roll them out and deliver them to the people who really need them.
Professor, thank you kindly for your time this afternoon. Professor David Walwyn, University of Pretoria, and we've just been having conversations about capacity and capabilities of producing our own vaccines locally. When we